Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. I've been asked many times over the years to provide a presentation to various companies and organizations on the ability of dietary modifications to prevent or improve symptoms of depression. Until now, I've had to tell them, much to their disappointment and mine, that there were no published studies to show that positive dietary changes have any impact on depression or depressive disorders. There are studies that show that certain supplements can help and exercise can help, but no studies were available regarding dietary modification. Well, that all changed on April 20th, 2022, when a study published in the American Journal of Clinical Nutrition revealed that switching to a more Mediterranean diet was highly beneficial in improving symptoms of depression in a group of 72 young male patients aged 18 to 25 years old, who were diagnosed with moderate to severe depression. So in this randomized control study, the group that were provided with the dietary coaching aimed at switching them to a more Mediterranean-style diet showed a significant improvement in their symptoms and quality of life scores by the end of the 12-week study compared to the control group who did not make the dietary changes. Now, this is important for several reasons. One, roughly 30% of depressed patients fail to adequately respond to standard medical treatments for major depressive disorders, even when they're treated with cognitive behavioral therapy and or antidepressant medications. 30% of patients fail to respond adequately. Now, in Australia, where this study was conducted, 1 million Australians each year are diagnosed with depression, which not only diminishes their quality of life, but it also increases the risk of suicide, the leading cause of death in young adults. Now, this, of course, these stats are similar in many other countries. Now, the third point is this: nearly all the participants introduced to the Mediterranean diet stayed on the program. Now, this is counter to what most doctors believe, who think that people are unable or unwilling to make positive dietary changes, especially if they feel depressed. Well, with proper coaching from a nutritionist, it appears that they can and they will, and it really helps. As the researchers reported, and I quote, "Nearly all our participants stayed with the program, and many were keen to continue the diet once the study ended, which shows how effective, tolerable, and worthwhile they found the intervention." End of quote. So how might a switch to a Mediterranean diet be helpful in preventing depression and can also be used as an adjunctive measure in treating depression? Well, a Mediterranean diet emphasizes the intake of colorful vegetables, red, yellow, green, orange vegetables, as well as legumes, peas and beans, whole grains, some fatty fish high in omega-3 fats, olive oil, and unsalted nuts. In this study, the emphasis was on fresh whole foods while reducing the intake of fast foods, sugar, and processed red meat. It's thought that the high fiber content of whole grains, vegetables, peas, beans, and nuts serve as a source of fiber for the friendly gut bacteria, helping them thrive in the large intestine. What a lot of people don't know is that these bacteria are responsible for producing 90% of the serotonin found in the body, which appears to influence the brain via the gut-brain connection, or the gut-brain axis. Now, serotonin, of course, is the brain chemical that helps us feel happy. Higher serotonin levels are known to improve mood and feelings of happiness and contentment. The researchers conclude their paper by stating that these results highlight the important role of nutrition for the treatment of depression, suggesting that clinicians should provide this type of dietary advice and coaching as part of their treatment protocol for depression with specific demographic populations. So this is a very important study to help people with depression just move that improvement a little bit further down the road. So I've included the research study reference in the text below. Thanks for watching, and I'll see you next time.